So good afternoon all, and thank you for being here today. Today's decision to close the majority of Government of Jersey mainstream schools and colleges is one that I have not taken lightly. As a parent myself, I know the impact my decision is going to have right across the island, but it has been made in direct consultation with the Deputy Chief Medical Officer of Health and is fully supported by the Emergencies Council. I ask everyone who is affected by these closures to understand that every effort must be made to contain the spread of COVID-19, and no matter how hard, we must all work together and do our bit. This means that from Monday, the 23rd of March, our schools and colleges, which includes Highlands, will close to pupils. This will mean that our students' last day in their school or college will be this Friday, with 2 weeks of closure rolling into the 2 weeks of Easter holidays. The earliest estimated return date for pupils in Jersey is Monday the 20th of April. The Children, Young People, Education and Skills Department will use this month to determine if further closures are needed, based on health-led advice, and parents, carers and students will be advised in a timely manner should this become necessary. I recommend that private schools and early years and childcare settings also follow the same Government of Jersey healthcare advice. We will confirm the position on childminding later on today. All students affected by the school closures will be continuing their learning at home with work set by teachers. Schools will be open to staff and for some selected year groups, principally years 11 and 13, who have summer exams. Exam students in other years will also be accommodated. Secondary schools are making arrangements for minimal disruption to these students, but if there is any, then parents will be notified directly. In conjunction with this work, we are closely monitoring the situation with the various examination boards. We are also exploring keeping a small number of specialist education facilities open for some children with special educational needs, and more details will be announced later this week. Parents and carers will be urged to support their children to practice social distancing to help avoid the spread of COVID-19, which includes restrictions on play dates, parties, and all out-of-school activities and gatherings. The Emergencies Council have followed the recommendation of the Medical Officer of Health, Dr. Ivan Muscat, and restricted public gatherings for the next 10 weeks if they last for more than 2 days and involve 150 people or more in close contact. People are also asked to be responsible when attending smaller events, based on their own risk profile, with over 65 still advised to socially distance, whenever possible, outside their own homes. It is down to us all as individuals to assess whether attending an event will increase the risk of the disease being spread, particularly to friends and family who are more vulnerable than us. We want everyone to consider the latest health advice when deciding whether to attend. We have created a new webpage to help parents and carers talk to their children about coronavirus, with links to resources in English, Portuguese and Polish. And that information is being shared with all parents via their children's schools today. We are also working with colleagues from across government to see if we can organise childcare for some essential workers. Wider work is continuing to ensure the safeguarding of vulnerable children and adults. The Department of Children, Young People, Education and Skills will remain fully operational and will continue to provide support at this time, working closely with health officials. The situation is being kept under continuous review. Today, the Government of Jersey has also announced a series of measures totalling £180 million designed to provide much needed support to islanders and businesses. As health advice becomes more restrictive for islanders, rather than see natural closures happening, we are entering a phase of manage, control, support and advise. Due to the safety requirements of school premises, the disparate nature that may occur during this unprecedented time would be better served by managing the position in a more controlled and supportive way in order to assist in the extremely important messaging of social distancing and any need for self-isolation. We can, as you have already heard, flatten the curve, but only if everyone takes action. I appreciate this is an extremely challenging time for everyone. However, I cannot emphasise enough the importance of reinforcing the messaging around health advice from the Government of Jersey, including regular hand washing, and to read the new advice for parents and carers. This is a tough time for everyone. Let's look after our children together, and we will ensure extra support is available for parents. I would encourage children and young people to keep up with their schoolwork and to help their parents around the home. While you are at home, please make sure you keep in contact with members of your family and friends over the phone, if you can, particularly with your grandparents if they are over 65 and practicing social distancing. I am proud of everyone who has worked so hard, often with long hours into the night, from our department and across government to work together and support each other. To all our head teachers, teachers and lecturers and all those in early years and childcare settings, we are so grateful for all you do, particularly the effort that has gone into contingency planning for your students, vulnerable students and our exam students. By working together through a safe distance, we can get through this. You have the power to prevent, and by abiding by these health measures, we can save lives. Thank you. Any questions?
We have been told all along that Jersey has been behind the UK in terms of rates of infection. So why are we closing schools when they aren't being closed in the UK?
Okay, so this has been based on the advice that would have been announced this morning through the health modelling that Dr. Ivan Muscat would have shown everybody in the press conference today. Determining closing schools, as I mentioned in my statement, is about managing consistently and supporting and advising in the right way and putting on things that we can do to support children who may gather in areas and also that where there may be mental health issues. We're a small community and we've got some extremely good services and extremely good staff that we can mobilise our services in a different way to support families and students.
What about private nurseries? What's going to happen there?
Well, we've recommended for private nurseries to also close. I believe they are meeting this evening. We are carrying out further work. However, what I would advise is the announcement from the £180 million support that Senator Farnham recently announced will also assist. But there will also be continued funding through the Nursery Education Fund. And we will also be wanting to work with them to identify how they can help to support families and parents at this difficult time.
And what about parents who may find that they are asked not to work or they lose their jobs? In terms of securing nursery places and funding, will there be any kind of financial support or relief there?
At the moment, that work is being carried out over this next couple of days. Like I said, it will be working closely with private nurseries, but also this is a cross-government working piece. Well, we have to be talking with the likes of income support, with the likes of economic development, and ensuring from a children's perspective that we're holding up the rights and the needs of our public, and specifically our children.
You talked about not having birthday parties, not having any kinds of social gatherings. Can parents who are going to be at home with children, can they take them to the park? Can they take them to the beach? How can they contain them?
So this is the point in us putting up a web page and providing information to our parents. There'll be more specific information there for them. I won't go into every single detail right now because I'm sure there's other questions, but that will be available online and the schools will be handing out that information for parents today so they'll get a better idea, a greater understanding of what that social distancing means in their own circumstances.
Regarding the end date of the current closure on the 19th of April, it's been suggested to us that that should have been extended because some parents may, in spite of a recommendation against essential travel, go away over the Easter break and come back and then need to self-isolate. What's the message to people are thinking of doing that.
Okay, I'll briefly explain. Maybe Mark might want to expand on that. Our position at the moment is that we will have 4 weeks where we will be able to plan and support and readily, continuously review the updated health advice that we're getting regularly from Dr. Ivan Muscat. It's changing on an almost hourly basis. And so we will be, of course, looking at how that will affect parents, children, families before the end of the Easter holidays in order to advise whether anything changes, so we can prepare and plan, everybody can prepare and plan, and ensure that we're in the correct position in terms of not just preventing the spread, but also controlling the spread and saving people's lives. I don't know whether, Mark, you want to add anything to that?
So just to reinforce the Minister's comments really, so first and foremost, all of our decision making is driven by health advice. The health advice has been that from next Monday, if we implement a 2+2 week closure, then we will have maximum impact on flattening that curve. Should parents or carers seek to take themselves or their children away over Easter, then actually they would be going against the advice that the government is giving about essential travel only, and we would absolutely be discouraging that. It's not what we need at this time, and health advice is such that the maximising of the impact on the curve requires all the citizens of the island to follow the government's advice.
Clearly, this is going to impact people from Monday.
Mm-hmm.
Lots of people are not going to be able to go to work. You say you're working on other measures over the next few days. Will parents be able to feel safe that measures will be in place by Monday when it's starting to impact them?
Mark, Sean, is there? Mark and Sean. So Sean, from an educational point of view, of course we've got, so this is the Director of Education, we've got the position of homeworking and support from that perspective.
I was thinking more about financial support for employers and employees who are affected by this.
Okay, well that work is, like I say, ongoing, and we are, as you're seeing, regular announcements being carried out on a daily, sometimes hourly basis at the moment. It's a cross-governmental piece working with income support. We have specific issues, for example, in the student finance area. We will have frequently asked questions being put behind the scenes in terms of our helplines that we have in place to assist people, because there will be a string of circumstances and a string of different issues that people are facing that will affect them individually in different ways. So it'd be difficult for me to give a standard response to that particular question, hence the reason why we have the helplines and the support put in place. But from our youth service offerings and our education service offering, we can support and manage around the social distancing, around supporting the education of our children. But in terms of the financial envelope, these things will be announced over the next couple of days, because they are ongoing work.
By Monday, those who are worried about it should be able to have an answer to their questions.
Yes, I would hope so.
Minister, you mentioned that the plan is to keep special educational needs facilities open, or that plans are ongoing for that in that respect. These may include immunocompromised children. Is it safe to keep these facilities open, and could you elaborate on your strategy for those children and young people with special needs?
Okay. I'll ask Sean if he can take this one, please.
So we have detailed risk assessment and analysis of the needs of every single individual child in, for example, our special schools that you mentioned. We would not do anything that compromised their well-being. The very fact we're looking at the feasibility of keeping some of these schools and facilities open is exactly because children would be safer than not. So practicing social distancing, enhanced hygiene is going on throughout the piece. So whether it's those vulnerable children or those students in examination years, the starting point is that we don't compromise the big picture, where education is contributing to the island-wide flattening of that curve that Dr. Ivan Muscat presented earlier. But within that we obey all of those social distancing so nobody is compromised. All of this planning is to do the best by the children.
And in terms of Jersey children that may be receiving care or in secure schools off island, what is the plan for them? Will they be included in the Jersey strategy, or are they being left to the UK guidance?
So we have a range of young people off island. We have students at higher education, I think over 100 higher education institutes in the UK and beyond. We have some Jersey resident young children in private schools and boarding accommodation, and we do accommodate some of our vulnerable children in care settings. So in each group, active work has been done. Indeed, the Minister made a statement yesterday that some of those groups would be deemed essential for travel for returning to our island, yes.
And just lastly from me, the Children's Commissioner has raised concerns about families with safeguarding issues, whether that's about domestic abuse or any other concerns. What is being done to address the strain, the extra burden that it will put on those families when schools close?
Mark.
So, although not sitting at the table with me, at the back of the room is Mark Owers, who is the Director of Children's Services here in the island. We have been working across the department as well as between departments to make sure that we have those contingency plans in place to ensure that the safety and the welfare of children is our first consideration in all the planning that we're doing. I think it's fair to say that this week is going to be a week of rolling announcements, and we would probably want to say more both with the Education Minister and the Children and Housing Minister about some of the detail behind our planning to make sure that those children remain safe during an extended period away from school.
Thank you.
Hi Minister, you mentioned in the, I think it was the last state sitting when you asked about this, if it got to this stage, around home working for children. I think it was around IT infrastructure you mentioned, maybe not the best it can be. Obviously that might raise concern with parents now that students that have to be at home might not have the facilities they require to be able to, especially for exam students coming in. What can you say to reassure parents?
Okay, so there is a huge amount of work that has been carried out, and that's why I was thanking our head teachers, our teachers and our lecturers, because it won't just be facilities online, it'll also be children being able to take it home with them. That's why it's important for us to announce this today. It gives us that prepping and planning time. Parents have the ability to ask for any further information if they feel they need to do so. We're also in talks with our library services about how possibility of sharing books and utilising that service in a way that respects the social distancing and self-isolation system that we have in place at the moment. So there are a variety of tools that are at our disposal, I suppose is the best way to put it, in order to support these students, whether they have the appropriate technology or not.
Yeah, that's sorry.
I think it's also important to add that whilst today is the front face of the ministerial announcement, a huge amount of work has been going on for quite some time. So we've known about the virus for a while, and therefore we have been doing, in the jargon, business continuity planning for many weeks, and all of our schools have been well prepared for managing both the present situation, because we are seeing some disruption in schools as both staff and children become infected with the virus. So we already have plans to make sure that children can continue to learn. Those plans simply move up a gear, I guess, with the closure announcement. But whether it's online or whether it's physical materials, all of our schools have very well developed plans that they will now be putting into place in order to ensure that children who aren't safely brought back in, say for exams or for example into some of our specialist provision, will get learning every day.
What about for students who might become ill over the next few weeks for exams coming up, for example? Is there any leeway or extra support for them if they miss out on critical learning?
Sure.
So we are liaising directly with the JCQ, the Joint Qualifications Committee on Qualifications, and Ofqual, which is the overarching body. So our young people who take GCSEs, A-levels, other level 2 and 3 qualifications, those boards are updating their advice across the jurisdictions of the UK as well as obviously ourselves. There are always mitigations in place, so the planning we have to see how we can get the students in examination years with proper social distancing to do work will continue. Those who might be unwell, we have some with underlying medical conditions that need different access arrangements around time. All of that will be respected, although obviously it's a bigger picture as the examinations are indeed national and beyond Jersey's remit alone.
Yeah, I'm sure as well, sorry Brian, you just put me on this one, there's a responsibility on children to be sensible and go by the advice here. I suppose it could be so easy for them to not take this seriously, to them to nip out and go to Fort Region and do what they want. I suppose it's important for you, from your perspective, to give out that message that they need to be sensible here.
Yes, absolutely. I think it's not just children. I think there are adults that need to take that on board as well. We need to respect the seriousness of this. We need to flatten that curve. Our hospital would come under great strain and pressure if we don't. We all have a responsibility in this. It's not just government. As individuals, we all have a responsibility. We will do our part. We will play our part the best way that we can, changing our practices in order to support everyone in this time of need and difficulty. However, this is a personal responsibility.
Can we just ask a little bit more about the detail of homeschooling? Will it be for individual pupils to be given assignments and work on them, or is there going to be any sort of group teaching? For example, we've heard that Google Hangout is a possible way of involving the whole class rather than just individuals.
So there is, as the Director General said, affirming the Minister's earlier point in her statement, every single school has shared with us their planning. Some time ago, we've got the schools that are furthest ahead in either their planning or indeed the effective use of technology have been sharing best practice. You're absolutely right, more in the secondary phase with older students, technology enabled, although we have some primary schools very well set up for webinars and group tutorials and using blogs and some flip learning where the young people are feeding back the learning they do ahead of the contact with their teachers online. This is rapidly moving. Some of our primary schools, even for the youngest children, sent home zip wallets full of work should it ever be needed. So some of our parents said it may not be needed, keep it under the bed as it were, or somewhere safe and bring it back. Now that we're in the phase of the announced closure to children of our schools, work will be done by staff to bespoke that. We're looking at procedures where parents complete, say, the physical work if it's not online working, and at safe times in small groups can drop it back to the school in the period of closure. Staff are still working, who are well obviously, where they can mark that work and reissue. So we've used this planning time well, with well home systems, and those schools with greater prowess are sharing their expertise with others, which is improving it further.
What do you imagine sort of these online school working days are going to look like for parents? Obviously, parents who may not be that well equipped to be homeschooling their children now have quite a lot of pressure on them to take over a lot of the educational needs of their kids. I mean, are we meant to set up our days similar to a normal school day with breaks and different sort of subject classes and things like that? And also, what support is going to be available to parents who need it or who need advice?
Sure. So we've got a dedicated advice line, an email address and a phone number for parental support. This is at an individual school level. We're very clear this is a schooling system and education response to a much wider societal need led by health advice. Is it perfect? No. But the driver is to flatten the curve, as you've all seen that important graphic about the impact that this very strong measure of closing schools to children. So there will be support. We're not expecting every parent to have the professional prowess of those of us with a teaching certificate behind us, but in the sensible way of caring for children, so there is advice. It will look different school by school. I've seen some schools where they've given an online timetable and a schedule, maybe less sophisticated in some of the schools with younger children, but we will be on hand, and schools will have their workforce in.
So our parents and carers know their children best, and the responsibility that we're taking is working with our schools to make sure that the programmes of work that still need to continue can do so, but individual parents and carers will make decisions about exactly how they organise that work in the home. Our responsibility first and foremost, as Sean has said, is to make sure that we've got the right health measures in place. Our next responsibility is to ensure that all of our schools are able to provide a volume of work over a period of time that means that children's education is least interrupted by this action that we're having to take.
May I ask, for some of our children, going to a nursery or going to school are part of our plans to keep them safe from harm. Can you give us some assurances that measures are in place for those children who now may be stuck at home for a number of weeks, are going to be kept safe? Who are going to be the eyes and ears on some of our most vulnerable children?
So again, I'm going to refer both to the Education Director and to the Children's Director in the room. So between them and others, that's exactly the planning that we're doing. So initially we just needed to make sure that we had shared information in the department about every single child and their circumstances in order that we can then make individual decisions where we need to about additional arrangements to support them during this kind of difficult time. As I alluded to earlier, I think you can expect some more information to come out this week about the arrangements that we're going to make for vulnerable children, vulnerable families, and actually vulnerable adults as well. But we understand that for some youngsters, it's the routine that they have presently is there for a particular reason, and we would like to do as much as we can to sustain that routine or provide something different that's equivalent to that routine in order that they're disrupted as little as possible.
In terms of the duration of school closures, what are you looking at as a worst case scenario? I know Northern Ireland was saying 16 weeks of school closures. You know, what are you looking at here potentially? I know we're saying 4 weeks for now, but you must have a worst case scenario also in mind.
At the moment, as you can imagine, this is business continuity plans across the piece and trying to bring government doing practice differently in a different way. At the moment, and like I've said earlier, is at the moment we're at 4 weeks based on the current health advice that we have, and I have to stress that very importantly. It's based on Jersey's health advice, and so what we will be doing as we continue to do is get regular updates, have regular conversations with the medical officer of health, and as and when those things change, and of course the UK will have a significant impact on whatever they decide as well, but the important thing that we need to do is ensure that we advise parents, families, carers early enough so that they can plan. So that will be a continued piece of work over the next week, 2 weeks, making sure we're up to date, but as you can see we're trying to keep everybody up to date as and when we can.
So the worst case scenario is actually around the world that not every country does what it should do. That's actually the worst case scenario. Here in Jersey, what the focus has been, as in many others actually, is to concentrate on the health protection measures. So whether they're about self-isolation, and the measures around that have been ramped up, as you know, from last weekend, whether it's about social distancing or whether it's about responsible travel, all of those things need to interact with each other, but actually all the pieces of the jigsaw need to come together well. So health is driving this, but the Education Minister is ensuring that she's therefore responding to what that health advice is. But equally, you've seen Senator Farnham respond about how the business community might cope with matters, and so on. So we're looking at quite a complex picture, but education's responsibility is to take the professional medical advice and ensure that it maximises the opportunity for the social distancing principles to be adhered to the self-isolation principles to be adhered to. And back to an earlier question, we do need people to travel, or rather not travel, responsibly.
Any final questions?
This is a stressful time for everyone, children and young people included. Will you be pushing for extra resources to be added to children's mental health services or any other support for parents who are finding this particularly anxiety-inducing?
Okay, so I completely understand that it is an extremely difficult and stressful time for everybody. This is unprecedented. This is the first for many, many of us. What we do have, and I've stated this before, is because of the continuing changing health advice, we're having to also change our practices in the way that we're doing things, and we want to do it in terms of best practice for support for children and support for adults in the right way. We have a fantastic team at the Youth Service who provide counselling, who provide the Yes Project, who also provide support for vulnerable children. They will be looking at changing, well, they're currently providing us advice about how they're changing their model in order to assist with the social distancing measures and the self-isolation measures, such as an example, being able to do counselling sessions via Skype or FaceTime is an example of one of the things that they're looking to do, because they can't carry on the practices they're currently doing with the health advice. We're looking at prioritising their workload in the most effective way that will assist mental health for our younger adults and our children as well.
So can I just do one final from me? Just generally, your advice for parents, first of all, for these next 4 weeks when we in place, if things change.
So I'm going to say something that sounds like a cliche, but our advice is follow our advice. And I know that sounds slightly disingenuous, but I'm really serious. The government has been putting advice out on a regular basis, and sometimes it's not being read, or it's not being read often enough to fully understand what we're asking people to do. The most important thing that anybody can do in the island is follow the health protection measures that are coming out of our health and community services. In terms of preparing for the future, so we're not doing crystal ball gazing because, as the Minister has said, the health situation is dynamic, and it's not just dynamic in Jersey, it's dynamic because this is a worldwide issue. So we can't say precisely what will happen after the 4 weeks of closure. What we can say, though, is that the Minister is absolutely committed to keeping parents, carers and those students fully informed about what is likely to happen next when we've got the evidence to make good decisions.
Can I just ask a last question? What, in terms of frontline staff, nurses and doctors, they will obviously be impacted by these decisions too. What's the plan for them? I know other countries have used teachers and nursery staff to look after the children of frontline staff.
I think this is extremely important, and this was what really did worry me about closing the schools down. We have to recognise that schools are there for education, not for care. However, they do two of the same things. However, we are looking and exploring at how we can provide care for essential workers, so children of those essential workers. It's an extremely important thing, and I've got to stress this message. If we're expecting our health workers to look after us, we need to be looking after them. So that they can keep on top of their jobs, doing it the best they can on a day-to-day basis in an extremely changing, dynamic situation that we're in. But we need to look out for them as well, because this is something we've not seen before.